A total hip replacement is a surgical procedure that replaces damaged cartilage and bone in your hip with artificial components. Some hip replacements require a large incision on the back of the hip. This approach requires muscles to be cut in order for your surgeon to see the bones of your hip joint. A direct anterior hip replacement is a muscle-sparing surgical technique. A direct anterior approach uses a small incision on the front of your hip. With this approach, muscles are not cut. Instead, two muscles at the front of your hip are slit apart at a natural separation point. A smaller incision and less damage to muscles and soft tissues around the hip may result in less pain after surgery and a faster recovery compared to traditional hip replacement surgery. To begin a direct anterior approach for hip replacement, your surgeon makes an incision in the front of your hip and separates two muscles to gain access to your hip joint. With the hip joint now exposed, the ball portion at the top of your femur or thigh bone is removed. A tool called a reamer is used to prepare the acetabulum or socket to accept the acetabular portion of the hip replacement. This component includes a metal shell and a plastic liner. A femoral stem is implanted in your thigh bone. The ball or femoral head is attached to the stem. Femoral heads are made of ceramic, metal, or oxinium, only available from Smith & Nephew. The new ball portion of the thigh bone is inserted into the socket part of the hip. Before closing, the surgeon will move the new hip implant to ensure that it is functioning properly. The artificial components are designed to reproduce the mobility of the natural hip joint. In addition to the benefits gained by leaving the support muscles of the hip uncut, direct anterior patients who receive certain Smith & Nephew total hip systems may also benefit from advanced implant materials designed to help your implant resist wear. Our exclusive Verilast technology features oxinium hip heads, which offer the smoothness and scratch resistance of ceramic as well as the durability of metal. When compared to cobalt chrome, oxinium implants have shown excellent wear performance in both laboratory and clinical studies. Talk with your surgeon about the best approach and implant for you.